Welcome to the Advanced Heart Failure Program at UC Health. Today, we're going to talk about the process of heart transplantation. If you're watching this video, your treatment team has recommended that you consider heart transplant. This is a big step, and we'll be with you the whole way. There's a lot to learn. Evaluation for heart transplantation is an interactive process where we learn about you and you learn about us. Together, we make a decision about whether heart transplantation is right for you. You cannot face heart transplant alone. It requires a committed caregiver. This person will need to undergo evaluation and education process with you. Our goal is to understand what your risk of heart transplantation is. And this is a head-to-toe evaluation that includes blood tests, diagnostic studies, and consultations. We will be evaluating your medical history, considering any prior surgery and any medical problems that you have. There are some important barriers to heart transplant that you need to know about. Heart transplantation is not safe if you have an active infection or an active cancer. We cannot offer a heart transplant if you're an active tobacco or marijuana smoker or use any recreational drugs. Drinking alcohol in excess is a problem. If you are a former smoker or drug user, we will need 6 months of documented abstinence from use. Obesity can be a barrier to heart transplant. The body mass index, or BMI, is calculated and needs to be less than 35, which is a healthy BMI for surgery. Diabetes can be a barrier to transplant. It needs to be well controlled with a hemoglobin A1C less than 7.5. Your history of success taking medications is an important predictor if you will survive after a heart transplant. In fact, if you don't take your medicines regularly, take them incorrectly, or miss clinic visits, you will not be offered a heart transplant. Caregiver support, reliable transportation, and adequate insurance coverage are all essentials for heart transplant. Now, this evaluation process takes from about 1 to 3 months in total. Sometimes this evaluation takes place in the hospital, but more commonly is done in a series of coordinated outpatient visits. The process takes place at Cincinnati at UC Medical Center. Your cardiologist will request the evaluation, and then the first step is an authorization from your insurance company. Our financial team will also reach out to you so you understand your benefits. We will need to review your coverage for surgery and coverage for the medications that you'll need after transplant. Once this is in place, we get started. The nurse heart transplant coordinators will coordinate and lead you through the process. They are responsible for education and will be a valuable resource. You will meet pharmacists to review your medications. You will meet with a dietitian. Our social worker is an important team member and will be a valuable resource to you. We are knowledgeable about the challenges and stresses that go along with having a chronic illness, and we want to prepare you for success. Patients also meet with our psychologist, who will review any challenges and make recommendations to customize the support we provide. Our patients very often have depression or even post-traumatic stress related to their heart failure diagnosis. Also, patients like to explore the experience of receiving a deceased person's heart. Finally, sometimes our patients have feelings about being dependent on caregivers or fear about their mortality. All of this is normal, and we have support for that. During the evaluation, you will have continued visits with your cardiologist and will meet a cardiothoracic surgeon. We will perform a lot of blood tests. This will include your blood type. There are 4 blood types, and you will be listed with patients with your same blood type. We will also test your blood for antibodies. Typically, you're born with no antibodies to HLA, but you can get these during your lifetime. Sometimes you can get antibodies from blood transfusions, or commonly women get antibodies when they have babies. If we find antibodies, this can make it more difficult for us to find a match for you. After all of this work is completed, we report all of the results to the Transplant Selection Committee. This is a group of multidisciplinary team members made of the individuals that you will meet during your evaluation. All of the evaluation information will be shared, and one of 3 outcomes will result. First, the team may decide that you are too well for heart transplant. In that case, you will continue with medical therapy and perhaps be considered again at a later date. Second, the decision may be that you're too sick for heart transplantation, that the therapy is not for you. If that is the case, we will have a discussion about alternatives to heart transplant, which may include medications, a mechanical heart pump, or palliative care hospice. Finally, after the presentation, additional studies or consultations may be necessary to make a final decision. If this is the case, we will arrange the next step for you.